So I want to thank everybody for coming tonight. My name is Patty Schramm. I'm the Parent Resource Coordinator Trainer for the SALT Talks. Tonight's topic, we want to talk about waivers. Now, waivers for me was a very foreign word, as you might say. It took me a long time to figure out what they were and how to apply them. But I think it's one of those topics we try to include throughout the SALT Talks throughout the year, at least once, but you'll hear this term whenever we have these presentations, you hear this term on waivers come up. So I keep saying, well, we're going to have a presentation on waivers so we can kind of give you some direction or some idea of what they are and how you can use them or what they're used for. So with our speaker tonight is Sheila Bloom. She is with the Greene County Board of Developmental Disabilities, Medicaid Services Manager, right? Or Medical Services Manager.
Yeah, Medicaid Services Manager.
Medicaid Services Manager. And she's going to go through a presentation regarding the waivers. Now, we do ask if you have any questions, you can type them in the chat box and we'll address them as we go. And then at the end, when we're finished with the presentation, I will stop the recording and then we'll just open it up for discussion. So you can freely ask any questions, but by all means, ask questions. It's one of those topics. It's, ask away. So
Yep.
I'm going to go ahead and turn it over to Sheila, and I had you as co-host, Sheila, so you should be able to share your screen.
All right, let's see if I can get this to work. There we go. All right, well, just a quick little background on myself. As Patty said, my name is Sheila Bloom, and I'm the Medicaid Services Manager in Greene County. I have been with Greene County for about 17 years. I've held different positions. I've been in the administrative end, been in SSA for several years, was in the Medicaid department, and now I'm the Medicaid Services Manager. So I kind of have quite a various background as it comes to waivers. Like Patty said, it is a very big and broad topic, and it's kind of hard to hit on all the pieces at once. So if you have questions, please, by all means, bring them up. I'd be more than happy to answer those as we go through. So today, some of the things we're going to talk about is eligibility for waiver services, fixed list and needs assessment. That is where the waiting list comes into play, the 3 waivers administered by county boards, alternative options, because there are other funding sources other than just waivers. So let's get started here. Some background on waivers. The term waiver is a really kind of hard topic or hard question for people to grasp a hold of. Waiver really just means that the individual is eligible for services in a ICF or not quite institution type setting. What you are doing is you are waiving those services in a facility to be provided instead in a community or home-based setting. So that's really all that waiver means. You're not signing rights away, you're not doing anything like that. It is really just waiving the option to receive those services in a facility type setting and having those services take place in the community or in your home. There are different waiver programs for different populations. Obviously, today we're talking about individuals that qualify for services through the County Board of Developmental Disabilities. There are Ohio home care waivers, which are typically for significantly medically involved individuals. They do not have to be DD eligible folks. There are passport waivers for elderly. There's just a lot of different services available for different populations that all fall under waiver programs. So sometimes if you reach out to Job and Family Services, they might bump you in the wrong direction sometimes. So it's really important to make sure that everybody you're talking with knows that you're talking about DD waivers. Breakdown of waiver funded programs. They're funded kind of through different avenues. So we receive Medicaid funding from state and federal resources, and then we also use local tax dollars and local levy dollars. I will caveat that statement with a little bit of a different twist, because there are folks here from multiple different counties. Montgomery County is set up a little bit differently than Greene, Butler, and Warren, and how they receive those tax levy dollars. So just kind of keep in mind as we go through this, there are going to be some little differences between the different counties based on how they are structured. The evolution of DD waivers over the years, it has really been a big movement over the last 20 to 30 years to get our individuals out of facility settings and get them into community settings. So the DD waivers have evolved over the years to kind of support those goals in meeting our folks where they're at and allowing them to be healthy, productive members of society, and not really limit those institution and facility settings. Initial and ongoing enrollment of waiver services. The initial enrollment process involves eligibility for Medicaid services, as obviously these are a Medicaid funded service. So there's eligibility on the DD side and eligibility with Job and Family Services and Medicaid. Flexibility and portability of waivers. Within the state of Ohio, in all 88 counties, the waivers are transferable between counties. So if you currently reside in Greene County and you move to Montgomery County, that waiver can go with you. Now, if you leave the state of Ohio, every state has a different setup and a different system for how they serve this population. So keep that in mind as you're moving around. If you have questions, just know that those waiver services are transferable within the state of Ohio. Wrong button. There we go. So eligibility for waiver services. The first question is the individual eligible for Medicaid? That means, are they under resource limit? That means, do they have assets within the Medicaid guidelines? That is really a component that is crucial to the enrollment process. So when we first start talking with individuals, whether it's request for services, a result of a waiting list assessment, or just through conversations with your SSAs, Medicaid eligibility is a key component. I know in Greene County, we have a staff person that will assist our families with the Medicaid enrollment process. And we have a really good working relationship with our local Job and Family Services. I'm sure those contacts are available. There might be called something a little different between each county, but our provider support and relations department has a staff person that this is a good chunk of her job that she helps our families with this service. Meeting the intermediate care facility level of care. So back at the beginning, when I talked about waiving those services in a facility, this is the level of care that we're talking about. When we do these assessments, or when we determine if an individual is eligible for services, these are some really hard conversations with families. You know, none of us like to have our shortcomings or our limitations pointed out to us. But when we're looking at level of cares, when we're doing these assessments, I really like to tell families that you kind of have to step back and look at this as your loved one is having a really rough day. What kind of assistance do they need? You know, as parents, as caregivers, as loved ones, you know, we're going to wrap around and do whatever we can and whatever we need to support our individuals. So what would happen if we weren't there? What happened if we weren't there to give those prompts? That's the hard conversation that we need to have during the waiver enrollment process, is what are those limitations and what do they need for health and safety? So meeting that facility type level of care doesn't mean that they're going to end up in an ICF. That just means that they need a similar level of care, and we're going to work to provide that in the community, in a waiver setting, or even in an individual's home. Another big component of waiver enrollment is, can the individual benefit from ongoing services and supports? Waiver funds are not really directed for one-time purchases. These are for ongoing care. So ongoing issues, ongoing health and safety concerns, and just making sure that the individual is happy, healthy, safe, and being able to live their best life. So it's benefiting from at least one waiver service. And we'll talk a little bit more later about what those services and supports are and what they look like. Having a network of family, friends, and professionals. We have level 1 kind of in parentheses here. And that's really the level 1, as I'll talk about here in a little bit, is kind of our entry level waiver. There's not a whole lot of funding available through that waiver. So we look at this as drop-in type services, somebody that may just need help getting out and being active in the community. So somebody that has a lot of involved family, friends, even coworkers can be considered natural support and a part of our individuals' care and their service plans. Able to self-direct services is under our self waiver for now. And that's really just our individuals having more of a say and a little bit more flexibility under the self waiver than we have over underneath some of our other waivers that we administer. Fix the list. Those of you that have been involved with the DD system for several years are probably very familiar with Fix the List campaign that was initiated several years ago. The state of Ohio really took a hard look at waiting lists across the state. For those of you newer to the system, waiting lists were originally put in place as a future planning type mechanism, is what we used it for in Greene County. And it was really for, okay, yes, my individual, my loved one needs some care, but we're really looking down the road and what services might be available in the future. So let's get on a waiting list so that when that time comes, we're good to go, we're ready. That kind of ended up with over 88,000 people across the state of Ohio being on a waiting list. You could be on a waiting list in every county. You could be on a waiting list in one county. There were multiple waiting lists. This really was not a working, feasible system to get individuals the services and supports that they needed. So Fix the List came about, and it was a new approach and a new assessment tool that would be the same across the state. So no matter what county you were in, we were going to use the same assessment tool to identify what your needs were. So this assessment was going to determine if an individual had no real urgent needs at this time, or they may have a current need that within the next 12 to 18 months, we can see that there may need to be a ramp up in supports and services, like when our folks transition out of school. When you transition out of school, that structure and that schedule that was there may not continue. So what are we going to do to replace or supplement that? And then there's an immediate need. So within the next 30 days, we know that there's going to be a major situation popping up, whether it's loss of living situation, loss of caregiver issues, some really intense needs that we need to focus on right now. So those were the outcomes of this new waiting list assessment, this needs assessment, and it really reduced the number of individuals actively waiting for services across the state. And it gave counties a little bit better idea of, okay, here's where we need to triage, here's where we need to start our focus on helping these individuals in a very timely manner. So everybody that was on the waiting list as of that time had the option to have a waiting list assessment done or to waive that. And moving forward, that service can be requested by anybody. So you can request, if you're on a waiver, you can request to have that reviewed. If you don't have waiver services, you can contact your SSA or your county board contact and say, hey, we've had some changes in life lately, and we want to take a look and see where we're at on the needs assessment. And like I said, because we do have a couple different counties here, each county has a different contact person or a different way that you can initiate that process. Like they're saying in the chat box, you can contact your SSA. They will be more than happy to direct you. In Greene County, you can call our main number. You can ask for an eligibility or intake specialist, or just say, hey, I want to talk to somebody about the waiting list assessment, and they'll get you connected with the right person. All right. Let's see. Patty, have you seen any other questions pop up so far?
No, all looks good so far.
Okay, cool. Just wanted to make sure I didn't miss any. So let's talk about the actual waivers. DD boards currently administer 3 different waivers: the individual options or the IO waiver, the self waiver, and the level 1. So the individual option waiver is based on an ODDP or developmental disabilities profile. This is an assessment, another one. I know families struggle sometimes with the number of assessments that we do and that we have and that it involve in getting services for your individual. Believe me, we get that. Your SSA gets that. We try and combine those as much as possible, but sometimes it's not always possible based on what we're looking at. So because these are standardized assessments, that way we know everybody is being asked the same questions and being offered the same services regardless of what county they reside in. So the DDP has 9 funding ranges, and these funding ranges are what determines the amount of services available to that individual. Services under the IO waiver include homemaker personal care or HPC services. This looks a lot like your aid services, your caregiver services, somebody coming into the home or taking your individual out into the community and working directly with them. They can be working on ADLs, basic daily living skills, or different goals related to how to appropriately greet strangers, stranger danger, whatever that individual needs to work on. It also includes transportation, home modifications. That includes adaptive equipment as well. Respite, which again looks a little bit different in different counties, but respite is a waiver service. Remote supports is something that, with the provider shortage and provider crisis that all county boards and provider agencies are facing, it allows for services to be delivered remotely, or those little check-in and pop-in services that an individual might need. This is a different way to have that service delivered. It's a lower cost. It allows our individuals even more independence and flexibility in not having somebody physically up in their business all the time if they don't need that level of care. And then home delivered meals. So this looks a lot like your Meals on Wheels programs. A lot of the providers that do this service have all kinds of different dietary restriction meal plans available. And it's really kind of a cool service to have that, your individual that's living in an apartment setting or maybe with a couple other roommates and drop-in services. This way we know that they're having access to some decent quality food and it's delivered right to their door. Level 1 services. Let me preface this conversation with the Level 1 waiver is slated to undergo some changes later this year. We are not 100% certain on how all this is going to look. We do know that there are going to be some more self-directed options available under the Level 1. Some of the funding capacity and budgetary limitations are going to look a little bit different, so stay tuned. We'll be passing out and pushing out more information on that once it becomes official and we're good with all the rollouts. But as of right now, the Level 1 waiver covers homemaker personal care supports, transportation, remote supports, technology, all of that within the $6,750. Again, this is based on a Greene County budget. Some of the other counties that are on this call have different budget ranges based on the cost of living, cost of doing business in those counties. So for example, Butler and Hamilton County are going to have a little bit different costs just because of the cost of doing business within those counties. That doesn't mean those individuals are getting any more services. It just means that the reimbursement rate for those services and the funding ranges are adjusted based on the costs in those counties. So these numbers, like I said, reflect Greene County budgets. If you would like to, we can connect you with somebody in your county that can help explain a little bit more on exactly what is available within your county. But it's not a different rate for different counties. It's just the costs are adjusted for cost of living and cost of doing business. So also within the Level 1 budget is, again, home modifications, delivered meals, medical equipment and supplies, and then there's an emergency assistance piece. So this used to look like the help I've fallen and I can't get up emergency type services and buttons, but has really evolved as technology has changed and improved over the years. So this is also a piece that can be used in conjunction with assistive technology, remote supports, all of that to provide additional level of services and supports for individuals without having that physical body necessarily up in their business. So it allows them a little bit more flexibility and the options to live in the community more like their peers, their siblings, and other family members. There we go. All right, self waivers. This is another one that's going to be a little bit different for all of the counties on the call. Greene County has several self waivers that we administer. Other counties have chosen not to enroll as many individuals on self waivers for all different various reasons. They are a challenge to administer on the county level as well as from a parental standpoint. Self waivers kind of have two separate funding caps. We have a cap for children, which is considered birth through anyone still attached to a school system. So it can be your super seniors, it can be 18 and separating school, whatever that education cutoff is, that budget is a max of $30,000 per year, and the adults are $45,000 per year. And that additional funding is really to help cover day program services, employment services, things that happen after we separate from school. So you
Sheila,
can,
I'm sorry, there is a question.
okay, let me see here. Good question. Does the DDP assessment apply to all three waiver types? No, it does not. That's the short answer. The DDP is strictly for the IO waiver, and that is what determines the 9 different funding ranges within that one waiver. Level 1, you just have your max limitation, and that's it. So there's no different steps within the level 1. Self-waiver just has the adult or the child. So the IO is the only one that has different funding ranges based on an assessed need. So hopefully that answers your question. If not, let me know and we can dive into that a little bit more. Self-waiver, again, is a challenge. I don't think personally from a previous SSA standpoint or a pause specialist standpoint, it is not an easy waiver. The participant directed HPC service you see listed really looks like the HPC service under the level 1 and the IO, with the exception that the participant directed component means that you as a family, as an individual, can set the rate of pay for that provider within some limitations. So you can do anything from minimum wage up to max capacity, which is currently set, I believe, at 534. Don't quote me on that though, per 15-minute unit. So what this means is that you have a little bit of flexibility when allocating dollars within your waiver services based on how much you choose to pay your independent providers. This is just for independent providers. Agency providers have a set rate. Participant directed goods and services. I saw there were some staff on this call, depending on how long you've been with the county board and what your function is, you may or may not remember the infamous microwave story. When self waivers were first rolled out, the intention of this waiver was to be incredibly flexible and individualized for what each individual wanted to make it. So the microwave example was, let's say an individual is living on their own. They have staff come in to help them with meals, but if they had a microwave, they could be more independent. They could use that microwave and the home delivered meals, and they wouldn't need as much staff. So obviously that would reduce costs to the waiver, and it would make this individual more independent. So the thought process initially was that, cool, we can use this waiver to go on target.com, find a microwave, have that microwave paid for through the waiver and delivered to the individual's home. And now we're ready to roll. We as a state, as a system, quickly found out that CMS, or the Center for Medicaid Services, which oversees all of our Medicaid waivers, didn't quite like that option as well. So we've really kind of had to pull back and look at things from a medical necessity, a health and safety standpoint of what does this individual truly need? Do we need a microwave? You can argue both ways on that. But it's really for services and goods that aren't available under other waivers, under the Medicaid card, under private insurance. This is kind of a catch-all, last resort type of option. So obviously there's not going to be a set dollar amount per item or per service, because that just wouldn't make sense. So participant directed goods and services, again, is handled differently between all the counties that are involved. In Greene County, we have a team that gets together every week to review requests from SSAs and families to see how can we match these requests up with what the Medicaid and waiver rules allow us to do. So this is where your SSAs get really creative in advocating to meet an individual's needs, to really think outside the box and how can we make their life better, easier, healthier, whatever it may be. This is where you're going to see some of that creative planning come into play. Clinical therapeutic intervention, or CTI services, are a more specialized service than just your standard HPC. This service is delivered, depending on who delivers this service, the pay range is based on education of that person. So this is where we're looking at your behavior specialists. I'm not going to say ABA because it's not an ABA service. But this is where you're going to see more of the skilled care, the skilled direct care. Your individuals that require a lot more wraparound type services. Just your little bit, it's going to be more specialized. Residential community respite, just like we saw on the other waivers, remote supports, assistive technology, that is here as well. Functional behavioral assessments are limited to one assessment per year and up to $1,500 per assessment. A lot of times we will use that functional behavioral assessment and combine that with the CTI services to see what can we do to help an individual with behavior needs, with aggression, acting out, whatever that case may be. That assessment is going to direct those CTI services. Support brokerage is a service that we don't really see utilized a whole lot. This is where you can pay somebody else up to $8,000 per year to help you manage the self-waiver, manage these services. This really would only come into play, in my opinion, and what I've seen, in situations where family may not be available, involved, whatnot. But this is going to be somebody that'll work in conjunction with your SSA to making sure that you're getting the services that you need. In some ways, it can duplicate services that an SSA does. So that's really kind of why we don't see that service used a whole lot in Greene County.
There was another question out there, Sheila, about waivers and if it covers therapeutic services such as music therapy, therapeutic riding.
Okay, that is a very good question. The therapeutic services, music therapy, therapeutic riding, those are services that historically in Greene County we have seen covered under the participant directed goods and services of the self-waiver. We as a committee and as a county have really looked at these on a case-by-case basis and looked at the supporting documentation of the assessed need. So when we're looking at therapeutic horseback riding, we're looking at getting a PT, OT to really kind of assess or provide input on what is that therapeutic piece. So it may be an alternative working on trunk control. It may be working on hand-eye coordination, gross motor skills, fine motor skills, whatever that specific individual needs. So that's where we've seen some of those more specialized therapeutic services covered. There's also an option to have those service providers become certified as waiver providers. We'll talk about that in a little bit as well. So that those agencies or those groups can actually build a waiver directly and not necessarily go through the participant directed goods and services piece. Hopefully that answers that for you. All right, self-waiver for adults. This is where we see that jump from $30,000 to $45,000 per year. If you look, all of these categories are the same, with the addition of adult day array and non-medical transportation. Adult day array is going to cover everything from adult day support, vocational habilitation, individual employment services, job coaching, volunteering, all of those services that are going to take place during the time frame when typically our individuals would be in school. So this is looking at after we've separated from school, what does life look like? Non-medical transportation simply means the transportation to and from these adult day array services. So non-medical means obviously not doctor's appointments, but really towards these day services, the day programs, the community outings for those day programs, and employment opportunities. I think we had another question. Yeah, homemaker personal care. That can be, homemaker personal care can reinforce and duplicate some of those services, but we typically don't see HPC providers certified or having the background to provide those more therapeutic services. Obviously, there's an exception every time, but usually that's where that participant directed goods and services comes in. All right, talking about changes. Our adult day array budgets changed as of January 1st, 2022. So we had some pretty significant rate changes across just about every service we offer under our waiver programs. Adult day array budgets was no different. Again, these are the budgets for Greene County. We can get you budgets for the other counties as well if you would like. Just leave your information and what county you're from, or you can reach out to your SSA and get those changed budgets as well. So adult day array budgets are based on, you guessed it, another assessment. This is the acuity assessment. So this is based on the first 30 minutes of an individual's day at a day program, at a job site, at a community setting. What is that? What do those first 30 minutes of the day look like? What kind of help do they need getting on and off transportation? Do they need assistance in the restroom? Are there behavior issues? Are there medical issues? And just what kind of assistance? Are we looking at verbal prompts and reminders, hand over hand, or total assistance? So that is going to place an individual into one of these three categories, an A, a B, or a C. The first line you'll see is the 15-minute unit billing rate. So the services for all of our adult, not all, most of our adult day array services are based on a 15-minute unit. So that's where you're going to see the $1.71, $3.08, and $5.13 in Greene County. The daily rate for those services is that next line down. So your $42.75, $77, etc. That is going to be the total cost based on a 5.5 hour day. So that's the amount of money that that provider can bill Medicaid for. And then the last row of numbers is your annual budget. So this is going to be based on the level of care span year, which is unique to each individual. This part is not based on a calendar year. It's not a fiscal year. It is truly a level of care year, which is different for each individual. That's something that gets people tripped up a little bit when we talk about span year. So just kind of keep in mind that your date is probably going to be different than the person sitting next to you or somebody else within the county. So adult day supports, this is a service offered under the adult day array budgets. This is a service where we just really look at supporting an individual during the day. So we're not working, we're not working on vocational skills, we're not at an employment site. This is really just looking at an opportunity for social growth, independence, working on community relations, and having that safe outlet during the day, typically during the day. It can include volunteer opportunities. It can be a service delivered at a senior center. It can be used for individuals not working. This is one of our services that we see utilized when folks separate from high school or they're done working and they're kind of working towards that retirement age. So this is a service that you'll see included on the level 1 and the IO under a separate pot of funding money, but on the self waiver is included in that total $45,000 budget. That's where some funding stuff can get a little complicated and tricky to understand. Vocab is another adult day array service. This is where we look at creating and enhancing employment related skills. So let's say an individual wants to work in a nursing facility. We may have a program that allows them to work on janitorial skills or dietary skills, food service. This is where we have a goal, we have a time frame. This is what we want to do. This is our plan. This is how we're going to work towards trying to get a job, trying to keep a job, or trying to transfer into something else that an individual may want to pursue. So again, this is a little bit different in that we're looking at employability related skills, transferable skills, and we really have a plan of this is where we want to be. This is what we're moving towards. This is what our individual wants to do. So this is a vocab service, again, available on all 3 waivers. It just depends on which waiver you're on and where that funding comes from. Individual employment supports, the best way to describe this service is job coaching. So this is a one-on-one service that is offered, and it's really somebody coming in and working with an individual either in an employment setting or working towards that employment setting. We also see job coaches or employment specialists come in and help to save a job. So let's say we have an individual struggling a little bit with the social cues or the social component of a work environment. This is where we can bring in employment supports and kind of help strengthen the relationship between individuals and their employer, their coworkers, and really kind of come up with a team plan of how are we going to keep this individual here if this is a good fit, or what are some skills that we maybe need to work on to move forward or find another opportunity. So this is really what historically we would call job coaching. The same thing with group employment supports. It's just offered in a setting of 2 or more. Career planning services. This is something that has kind of gained traction over the last 5 to 10 years as we look to have more individuals employed within the community. So these are all different services that can be billed against the waiver to really help support our individuals as they pursue or maintain some kind of employment within the community. So these are all separate services. And they're all things that we can look into a little bit more, and your SSA can help you plan for those services and determine which one is going to best meet your needs.
There's a question out there, Sheila. It says, is this job coaching separate from OOD services?
Yes. Again, this is can be a difficult concept to understand, where OOD services are yet a different pot of money. They are not connected to waiver services. However, some of the services offered by OOD mimic waiver services. So job coaching through OOD is really going to be kind of in that condensed time frame where they may have their 90-day placement and then OOD phases out. What we can then do is use individual employment supports on the back end of that to continue to support an individual in an employment setting. So OOD can work kind of in conjunction with waiver services, but typically where we see that is we'll see a referral to OOD placement, that initial intense job coaching. And once that job coaching is faded out or that 90-day timeline is up, that's where we can also see about using those employment services for some of that periodic job coaching that may pop up down the road after OOD has closed their case. Yes. Andrea, to answer your question, yes. Is this what the employment navigator can help with? Yes. The role, at least in Greene County, of our employment navigators is to really bridge that gap or bridge those services between OOD and DD services. Our employment navigators in Greene County work really closely with OOD. They're in on planning meetings, they're in on job coaching updates, and they really kind of work to provide that seamless transition from OOD to longer term services typically under the DD waivers. Okay, yeah, I wasn't sure about Montgomery County. But yeah, that's what we use our employment navigators for. Non-medical transportation. Again, kind of a funny sounding term. But non-medical transportation is what we use to get our individuals to and from employment opportunities and or day programming, day array, adult day support services. Again, this is a Greene County budget. Other counties, your dollar amounts are going to look just a little bit different, but it's still the same amount of services. So our annual amount for non-medical transportation across an individual span year just went up to $11,151 per span year. Non-medical transportation is offered in 2 ways. It is per trip or per mile. So a trip is going to be from an individual's home to a day program location. That's one trip. A second trip is going to be from that day program location home. So each of those trips, certified providers are able to bill $20.29 per trip. This comes out to roughly 520 trips per year. And that covers a little over 240 days of day programming. Per mile, this is broken down between a modified and a non-modified vehicle and the number of individuals in that group. A modified vehicle is going to be a vehicle that needs permanent, specific modifications to safely transport an individual. This is where you'll see the need for tie downs for wheelchairs. That's typically the most frequent one that we see. And that's obviously going to be billed at a higher rate than an individual that can get onto a typical seat on a typical bus. So per mile versus per trip is really a conversation that will take place between you and your SSA and the providers. Typically we see the per trip. It's a cleaner cutoff, cleaner amount, and a lot easier to track and plan for. So that being said, we can also do trips and miles at the same time. So they may use miles during the day if they go on a community outing or to an alternative location, while they still have those 2 trips to and from that location site. Let me do that. Let's see what that question is. Would this include transportation to a job? Yes. So when we talk about non-medical transportation trips, we're talking about from a home location to a race service. So if that individual is working at Panera, their non-medical transportation trip is going to be from their front door to Panera is going to be considered a non-medical transportation trip. If they go to a day program, it'll be, again, doorstep to doorstep. It's wherever they are receiving that day race service at, if that makes sense. Alternative options. Oh, hang on, we got another question. Oh, okay. Alternative options. As county boards, we have a responsibility to be fiscally responsible for all of the money that we oversee and that we authorize. That being said, we typically have a hierarchy that we're going to look at when trying to authorize services and meeting needs for our individuals. A good way to look at this in a more tangible way is to look at these as insurance. You have your primary and your secondary. If that happens in your household, maybe you have insurance through your job and your spouse or your loved one has insurance through their job, and one is always going to be billed first. That's how we are looking at providing services for our individuals, because we want to be responsible with those tax dollars, with those levy dollars, and how we allocate them. So an individual may have a need that we can meet through a little bit of local dollars without having to allocate all of that waiver money, so that we're not being responsible and setting aside that money for an individual if that's truly not what their need is. So in Greene County, we would look at an alternative, which would include family support services, which in Greene County right now is up to $800 per year for an individual living with family that is not on a waiver. So this is where we may see a family reach out and say, hey, my loved one, just had surgery. We just need a temporary portable ramp to our front door. So this would be a one-time cost. This is not something that they're going to need ongoing supports at the moment. So we can use this family support services money to kind of meet that quick need and still be fiscally responsible in what we're allocating. Supported living dollars and local funds. This is where in Greene County, we look at providing services for day programming as kids separate from high school, kind of getting them wrapping around some services and seeing what does their future look like. Are they going to be at a day program setting on a routine basis? Or maybe we're having just a rough behavioral episode and we just need to put a little bit of money towards this while we figure out what the need is or what's going on with this individual. These are all services that can be accessed in Greene County through a call to our main desk, or your SSA can absolutely fill you in on what services are available and that your individual is eligible for. Community resources, we really look at partnering with other agencies, whether it may be a referral to a food bank in their community, linking them up with transportation alternatives within the county, or daycare is another big one that we're seeing a lot here recently. And what daycares are taking kids over 12, or what daycares can handle behaviors. You know, some of our kiddos can't go to a typical daycare. So it's really kind of connecting our folks with alternative resources that'll still work and meet those needs that they have. Let's see, I think we had another question. If the provider of the day program provides transportation, does that also get billed non-medical within the budget? Kathy, let me see if I'm thinking of this the same way you are. So we have a provider in Greene County, Greene Inc. They are a day program service. They're a day program facility. They do offer other services, but they do their own transportation. So Greene Inc. buses will pick up the individuals and bring them to day programs. So Greene Inc. is actually billing 2 services for an individual during that day. They will bill non-medical transportation, getting them to and from their own location, and then they will bill day programming or adult day support or whichever service while the individual is there that day. So most of our day programs do provide their own transportation. We have a couple day programs that are just outside Greene County lines that we may work in conjunction with another provider to get those folks to and from. What are the options for daycare for older students with special needs in Centerville? I know in Greene County, we are currently working on a pilot project with some local daycares that have expressed interest in working with some of our folks. It may be something as simple as they just don't know how to work with some of our behaviorally challenged individuals. So it may be providing training for those daycares. It may be helping them with an accessibility issue. One example that we saw recently was handrails. The handrails that they had going in and out of their daycare facility met ADA, you know, all of our fun standard business options that they had to have for outdoor guardrails or handrails, but they weren't designed for kiddos, for our little kids. So it was working with them to come up with another option for lower handrails to let our little kids be able to access those buildings. So as far as what's available in Montgomery County, I'm not really sure exactly. But we should have some information. Either earlier was the Montgomery County website, or perhaps somebody from Montgomery County can chime in here in a little bit. It is a really hard service to find. You know, daycares are facing shortages across the board regardless, but then trying to add in our kiddos who may need a little bit of extra help or maybe older than what daycares typically take, it's a big challenge for families. So yeah, always reach out to your SSA. That's really good advice. If you're not connected with an SSA, absolutely contact your county board and say, hey, I need some linkage and referral, or I need an SSA. Who can I talk to about this? That's going to be your best bet to get those services. Let's see. Yeah, perfect segue. Ongoing county board supports, transition coordinators. Greene County, Kathy Kleiser is on here as one of our fantastic transition coordinators. They are really working to bridge that gap between school and what happens after school. Once they separate from school, what does that look like? What can we do now to get them ready for that? And obviously reintroducing county board services to folks that maybe haven't had as much involvement with us over the years. But really, as they get closer to separating from school, what does that look like? So we lean on our transition coordinators quite a bit. Service and support administrator, those are the SSAs we've been talking about. If that's not a term that's familiar to you, a title a little bit more relatable is case managers. So these are the folks that are really going to help you to utilize these waiver services, to develop a service plan that is going to address every aspect of life, and what supports do we need to keep your individual safe and happy and healthy, and what can they do to help you make that happen. Your SSA is going to be your advocate at the county board level. Obviously, it's really hard from an administration standpoint to know every possible little need that's out there. So this is where, like, our day program or our daycare options has kind of come through Greene County, is through our transition and our SSA department of saying, look, we have a lot of families that are reaching out to us with this need. What can we do about it? Those two groups of people are fantastic advocates. They have all kinds of resources and connections throughout the county. That is really your go-to person, your point of contact at the county board. Provider supports. We've talked a little bit about providers and agencies providing these services. Most county boards have a provider support department that will help answer certification questions for providers, help providers with billing issues, help them with certification issues, be that communication between providers and the state department. They're really just a good resource to keep our providers moving, keep them engaged, on top of their certification, so that we don't have any lapses in service. So these are all some fantastic resources at the county board level. In Greene County, we also have benefits coordination and assistance. We have a staff person that helps with SSI, SSA, SSDI issues, trusts, protected trusts, stable accounts, Medicaid programs at the local JFS level. We have a really great working relationship in Greene County with our local JFS, and then benefits analysis for our individuals in the workforce. Continuous waiver support. We are the world of waivers is always changing. We had a lot of rate changes come out January 1st. We have some rule changes slated to come out again later this year. So continuous waiver support. This is something that county boards are always working on in one way or another. So whether it's our interaction between JFS and DODD at the state level, making sure there's no issues with waivers, with span years, with kiddos aging out, whatever the issues might be. Payment authorization, making sure those providers are getting paid. Provider shortages, the DSP crisis that we have. It is really important that we get our providers paid in a timely manner, because if they can't meet their payroll, then we're going to be in an even bigger hole than we already are. And then obviously provider billing issues. Again, we want to make sure that with the rate changes, with code changes, with all of that happens behind the scenes, that we have staff available at the county board level to work with our local providers and establish those relationships, so that they can just give us a call or shoot us an email and say, hey, this isn't working, or can you explain this to me? And it gives them a local face, a local contact that they can work through these issues with. Because waiver world is a complicated beast. Here is the DODD website. There are all kinds of fantastic resources available through DODD. There's a whole section on supporting families and, DODD rules. If you like reading rules, all of that information is there. Health and safety alerts, trends that we see across the state, as well as just, there's a tab on waiver services, health and welfare, all kinds of resources that are available to anybody at any time across the state. And like I said, there's a tab completely dedicated to waivers and services. There are some resources available on the DODD website that have simplified language. So it takes all these Medicaid waiver terms and just the state jargon that we have to have, and it makes it a little bit more basic, a little bit easier to understand. You can find some of those links in there as well. And then I believe there's also ways within that you can reach out directly to your county board. It's like there is another. Awesome. Thank you, Michelle. Yes, that is the link to the DODD website, the homepage. Like I said, the waiver world is constantly changing. It's a complicated system. Please don't hesitate to reach out to your counties. There's always somebody available that can answer questions. If you have a question, please reach out. Odds are we've had that question before, or we've heard it before. It's just a really hard concept to grasp unless you're kind of in the middle of it, if you're in the trenches. And even then it can be a challenge to understand, because like I said, we just had a bunch of rule changes roll out. The reimbursement rates have changed, definitions have changed. So it can be really a hard topic to stay on top of. I think that was all I had as far as the presentation goes. I am more than happy to answer any questions you guys might have, provide any additional feedback, anything like that.
Looks like
All
there
right.
is another question there.
Yep.
And it says something about where does shared living come in?
Shared living. Shared living is a service available under the IO waiver. And that service was originally designed to assist individuals in living in a community within maybe not a traditional home setting. So let's say, for example, that I don't have a whole lot of family around, and my neighbor that I had growing up has decided that they want to be my caregiver and I'm going to live with them. So they are completely absorbing me into their household. I'm just another family member within that household. That neighbor can become certified as a shared living provider. What that means is they are able to bill at a daily rate to be reimbursed for my care. So it is if you are an adult on an IO waiver living with your provider, that is where we see that shared living service. So it is really designed to kind of meet some creative housing needs, creative service needs, and provide care in a home setting while that provider is reimbursed for taking care of me every day. So that shared living rate depends on which one of the 9 funding ranges I fall into. So a provider is reimbursed on a daily rate based on where I fall within those funding ranges. And there's some different certification documentation for shared living service, but in a nutshell, that's what that service is for. Andrea, did you have a question?
Yes, I did. Thank you so much, Sheila. You've done a great job tonight explaining waivers for all across Ohio. You should be commended. You've done a great job.
Well, thank you.
I just wanted to put out there, and I really liked, Sheila, how you mentioned every county is different. And I've been with Montgomery County Board of DDS going on 20 years now. And we have always tried to encourage all of our parents to reach out to their SSA. If you're not sure who your SSA, please get on our website, call our intake line. If you feel like the SSA isn't able to answer questions for you about, waiver dollars or summer camp or RESPA dollars or anything in general, keep trying to reach out to somebody that can attempt to give you that right answer. We don't always have the right answers, but since the SSA evolution over the past 20 years, that is the point of contact.
Yeah.
And they can walk you through steps to go through. And again, I put in the chat box earlier, our website is there, or please feel free to contact me with any questions if you're a Montgomery County parent or family member on, and I can get you going in the right direction. But you've done a great job, Sheila.
Thank you. Andrea, that's a really, really good point to bring up too. Your SSA is your point of contact. You should absolutely be able to rattle off who that person is. If you can't, reach out to your county board. I know at Greene County, if you call our main number, we can look up your individual and we can see who your assigned SSA is. That SSA works for you. And just like with every relationship, if you are struggling with your SSA, if you just don't feel like things are clicking, ask to speak with the SSA supervisor. Every county has several SSAs. We will do everything possible to make sure that you feel comfortable with your SSA and that you feel like you are being heard and your needs are being met. It's kind of like a dating game. You're not always going to mesh with everybody, and that is perfectly normal. So if you are struggling with your SSA or maybe not getting, the feedback or the timely responses that you're hoping for, work your way up the food chain. Greene County, absolutely call our main number. You can reach out to me as the Medicaid Services Manager. We all work really closely together. But you absolutely have every right, if you are not happy with your SSA, to ask for a different one.
Looks like we have another question out there from Sandra.
Yeah, hold on, I hit the wrong button. I think it said, can a parent of an adult child with DD be a shared living provider, even if that parent is a guardian? Yes, is the very short answer to that. I know in Greene County, we work very closely with our probate court, just to make sure that everybody is on the same page. Because obviously, as a guardian, you would be overseeing the services and care that your loved one is getting. And when you are that person that's providing that service, we want to make sure that everybody is kind of, included in that loop. Everybody is on the same page. Everybody knows what's going on. So yes, that is an option. Please don't hesitate to reach out to provider support in whichever county you are in. Your provider support department should be able to answer any questions you have about the provider certification process and what that does look like for shared living specifically, because we've all gone through the guardianship process and that communication. So just reach out, please, to your provider support people.
Well, it looks like Sandra's awesome. Would you explain the respite services available through each waiver?
Okay, so respite services kind of look a little bit different if you're on a waiver versus you're not on a waiver, especially in Greene County. If you are on a waiver, respite services can be in an ICF, so in a facility setting. They can be in, Greene County operates a respite home where we actually have a provider agency that agrees to staff that, and you can set up dates. So you can book a stay, kind of like an Airbnb, I guess, for your individual, and we will provide that staffing, and we will build a waiver for either respite or HPC services. So respite really depends on where that service is being provided and who is providing that service. Anything available for in-home respite. In-home respite can be HPC services where, let's say you're going away for the weekend and you just need somebody to stay with your loved one. You would rather it be in their home where they're comfortable and familiar. That provider, agency, independent, whoever, can actually come and stay in your home, and there's different ways that they can bill that service. So they can bill as just that typical HPC rate. If your individual has to have care overnight, whether that's repositioning, checking vitals, trach, ventilator, whatever, or do they just need somebody available in case something comes up? That's where a provider can bill what is called on-site on-call. They get a lower rate for those every 15-minute units, but that's just kind of like they get paid to be there. And then they can bill at that HPC rate should that provider need to wake up and help your individual, whether it's, just get up every couple hours to make sure that, they don't need repositioned, or they need a glass of water, they're having a behavior, they just need that redirected. So that's where you can work with your SSA to identify where is going to be the best place for those respite services to be provided. Does that answer your question, Sandra? Oh, you're fine. You're absolutely fine. That's the whole point of this. Waiver rules are really complicated, and there's so many of them, and there's so many different services, and they're called things that honestly, as a parent, make zero sense. And they've changed over the years, just like position titles. SSAs used to be case managers. I don't know why we ever got rid of that. It was easy to understand their job. But yeah, absolutely. Please don't hesitate to reach out. Andrea has made herself available for the Montgomery County folks. Kathy and I are always available. Patty has our contact information. like I said, don't hesitate to reach out. That's it. That's absolutely what we're here for.
And I think at the beginning of the chat, we also had the contact from Butler. Amy Caldwell put her
Okay.
email in there from Butler.
Benefits coordination, yes. So we'll start a conversation with an SSA. Yes. Your SSA is your resource regardless. Even if you're just using minimal services or, thanks to COVID, if your world has upended everything, absolutely. You do not have to have, ongoing or frequent services, anything like that. Your SSA is always going to be your first point of contact. If you don't have one, ask for one. That's absolutely the best place to start. I think I skipped a couple questions. Benefits and coordination assistance is a really big topic, especially this time of year as we get closer to the end of the school year, and deciding if folks are going to walk, accept diploma, formally separate from school. What is that going to look like? Or they just got a job. What does that mean? How much money can they make? How many hours can they work? What does their Medicaid benefits look like with all of that? Absolutely. Every county has somebody that can help you through that process. And it is very complicated, very confusing because it involves multiple agencies at the state and local level. So that's really, again, where your SSA can connect you with that. Dry run for respite services. I think that's what that said. Best way to dry run, try out. We have had multiple situations where even just onboarding a new provider, it doesn't even have to be, doing a dry run for respite services, just onboarding a new provider. That's billable. That is a billable service for that provider. Your SSA can work with the agency, work with the independent provider, and just, it can go as slow or as fast as you need it to. Obviously, if it's an emergency situation, we're going to make do. We're going to do what we can. We're going to make it work. But this is really where the strength of your ISP with your SSA comes into play, because ideally your SSA has already helped you to come up with a basic game plan for that. Your SSA should help you plan for, or at least have an idea of, what do we do if, what do we do if mom ends up in the hospital? What do we do if I end up in the hospital and I need a little bit more care? Or what happens if mom and dad go away for a weekend? Those are all things that your SSA should be discussing with you. What are your future plans? What does it look like if the world goes completely to crap? What's your plan? But yes, absolutely. We can build in those first couple visits of getting to know you. Just doing those trial runs, those are absolutely billable. I just lost that one. I've had people stay in town during the first. Yep. Out of home visit. Yep, absolutely. You could absolutely do that. You can do just hey, mom and dad are gonna go shopping for the day, whatever. Let's do a short trial run. There's a lot you can do with technology nowadays too, whether it's, setting up FaceTime calls or, building up towards that, like, okay, mom's going to run to the grocery store real quick, and FaceTime while mom's grocery shopping. There's all different ways that you can build up to that. And obviously, as a parent, as a caregiver, you know your individual better than anybody ever will. No one is going to provide services quite like you do, but the best way to ensure that success of any provider is to be open and honest. As a parent, sometimes that's a really hard conversation to have. And sometimes you don't realize exactly how much you do for your loved one until you're trying to explain it to somebody else, or you're trying to set up that system for somebody else to step in. So a lot of times it can be a good exercise just to try that. You may just do 1 or 2 weekends a year, but just getting in that habit of, how do I let somebody else step in successfully? Obviously you don't want the provider to fail. You don't want to set your individual up for failure. So those are some really hard conversations, because saying you help your individual brush their teeth, that can look a whole lot of different ways. And they may do it for you, but they won't do it for somebody else. Or, you may find out that your individual is capable of other things, because it's not mom who's been yapping at you for 20 years to brush your teeth. And all of a sudden somebody new comes in and they want to show off. So, hey, guess what? I can brush my teeth. So it's a good thing for individuals and families to work towards, but it's a process. And you got to trust the process, and you need to be open with your SSAs and your providers.
And I know there's some families that, might say, well, we had an SSA, we worked with DD services when Martara was younger. I don't know who they are, maybe, or how do I reconnect? Just call the office and just say, we had services. Just explain, I had services when our child was smaller, or I don't know who our SSA is. Just call and explain, where you're at and what you would just like to connect with an SSA, and they'll look up to see if there's someone assigned to you. Unless you have to go through re-eligible or, like redetermination type thing.
Yep, absolutely. Just reach out and give us a call, and we'll get you connected.
Yeah, and just start with them. And sometimes parents, Sheila, don't know. I've heard this so many times, and I experienced it too. We don't know what to ask. We know there's questions out there, but we don't know what the question actually is. And so what I was doing there, I would email our SSA. I knew what, or who our SSA was. I would email him and say, hey, this is going on. Is there something that is the DD board can do? Whether it be communication, or maybe simple, you notice that they have trouble with, early on you talked about home modifications. I see some people have trouble with steps. Some people have trouble with something else. Tell your SSA all these things, like concerns or things you see, and they can look at the waiver situation. They can look at the funding. They can look and see what they can do maybe to help.
Yeah, absolutely. Absolutely. And that's, a lot of times you're probably not the only one that has that question. So feel free to reach out, like Patty said, if it's your SSA, if it's the front desk person, whoever it is, just say, hey, I just, this is going on. This is what's happening. Just help. What can we do? A lot of what your SSA is going to do is problem solving and troubleshooting with you. And there are no dumb questions. There really aren't. Odds are we've heard it before. We've dealt with it before, or maybe we should be, and we don't know that. I know with COVID and all of the fun fallout from that, a lot of things have gone virtual, or they've gone online, electronic. Check your social media, follow your county board on social media, take a look at their website. A lot of times when you're in crisis mode, or you really don't know what's going on, you kind of get that tunnel vision, and you may not see what else is available. So just, if you're scrolling through Facebook, check out your county board Facebook page. I know Greene County is going to be putting up some parent surveys here shortly, if they're not up already. as just other ways to reach out and connect with your county boards.
I'm going to go ahead and close the recording for right now. I'll be on for a few minutes for those who want to have open up with some questions. If you didn't type a question in and you just want to ask it, this would be the time to do it. But I'm going to go ahead and close the recording for now. 1 second while I do that.